Yeah, so let's talk about that because that's an interesting topic. And it really starts with, first of all, understanding that the journey of someone with dementia or specifically Alzheimer's is a slow journey. It happens over time. It can happen over 5 years, 10 years, 20 years.
Yeah.
You won't see big changes, especially in the
Usually.
beginning. You won't see probably hardly any at all. It'll be your friends that'll say, "What's going on with your loved one? I see a change in them." So that is typically the way the disease process is going to operate for most all the people that we've had over the years that we've had. But I'll tell you, every once in a while, there's going to be a radical change in behavior. Something that maybe you had never seen before in your loved one that's startling. And your first conclusion is going to be, that's it. He's at the end stage here. We're ready to move on now, and he needs to seek additional care or comfort. And that's probably not the case.
Right.
Right. So we kind of narrowed down to three different things that could be going in their lives that are creating this radical change of behavior. One is environment. So for us, environment is not that big a deal. We adapt to environments. We do it all the time. We've done it all of our lives. But now you've got an individual living at the house who's very comfortable in that house, but something happens in the house. And it can be something as simple as we've got people in the house now painting the bedroom, right? Changing the environment from what it was before, because change is very difficult. They prefer a nice, easy day. And by doing that, it can change it. Another big one would be holidays, right, Laura?
Yes.
Because you've got people coming in typically from out of town. So now you're preparing for the holiday at home. So there's a lot of different things going on in the environment that weren't going on previously to prepare for the people that are coming into town. Now the people arrive from out of town, and if they haven't been properly coached in what's going on with your loved one, the loved one looks just like they did the last time they saw Grandpa 3 months ago or 6 months ago. Grandpa, of course, is on the journey and is now changed somewhat from what he was before. So the environment has changed now with all these people in the house.
And then there's another factor there too. I don't mean to interrupt.
It's okay.
You, but even without a dementia patient at home, holidays tend to be stressful. Just preparing your house and getting ready for company and that kind of thing. So there's already stress involved. Then you have this added element of planning around a dementia patient, which increases your stress level also. And with dementia, as we always say, emotions are contagious. So that's just another element.
That's true.
Go ahead.
No, it's a great point, right? So the loved one is also now showing stress, and now the loved one or the person with the disease is feeling the stress of the other one, and again, it's codependency, and now everything's getting worse and worse. So you've got to really be aware of an environment because that can cause then a radical change of behavior. And we're going to have other podcasts to teach you how to prepare for the holidays so they won't experience that radical change of behavior. A second reason that we see is medication. I think people need to understand, hopefully they do understand, that this is a disease, it's a terminal disease. It's created brain damage, you like to say, Laura, in these individuals as well. So these medications that they're taking are very powerful.
Yeah.
And they don't feel that powerful to either the loved one or the person with the disease because they don't see much change from them. And unfortunately, the medications only provide a minor change and may slow it down a little bit in the beginning and probably not as much at the end. So you're not as apt to be so concerned about giving the medication to your loved one. And it's so important that we never miss giving them medication at the same time, at the same day, at the same quantity when they need it. I've had people come in and say, well, I forgot to reorder the medication and they've been without it for a couple days. And that behavior can change radically because, again, of the power of these medications. So you need to be aware of that. And also you need to be aware, right, Laura, if your loved one's got a cold all of a sudden and you give them NyQuil.
Yeah. Yeah, that can affect a dementia patient way different
Yeah,
than it affects. Sometimes it could be just the opposite. Like if it knocks you out, they might be up all night.
exactly right.
Yeah.
But it can be as simple as aspirin, NyQuil, or something, some pain reliever that you've given them that in the past was never a problem, but now all of a sudden it's a serious problem. Those are the times you need to talk to, and your pharmacist is really your friend. They know what medications your loved one's on. And I would always suggest anytime you're adding any medications or deleting medications, when you're going either way, increasing doses, reducing doses, or not taking them anymore, that you talk to pharmacists who are truly trained in the interaction of medications in people. Because, and the neurologists, I tell you, they're not trained in that. They know the medication that they support and that they provide, but they don't necessarily understand the interaction between that and something for rheumatoid arthritis or something else that this person also needs to function in their lives. So there could be, again, that interaction between these medications. In the past, never a problem. Now it's a big problem. We see a significant change in behavior. If you remember that it's slow and gradual, and he wasn't this way yesterday, but he's a different person today, it could be a result of environment, medication, and then there's one third one, which we've seen over and over again. Yeah. And is there some underlying medical condition going on?
Right. Yeah. And it could be anything. UTIs are very common and easy to find. So that's usually the first thing we check. Does this person have a UTI? If we see a radical change in behavior, a lot of times it's just a UTI. And once they get the antibiotics that they need and get past the disease, they go back to baseline. So they're not going to get well completely, but they go back to where they were prior to the radical change in behavior. But it could be anything, any kind of infection. It could be a toothache, anything.
Sure.
Anything medical. They could be feeling pain, and they aren't able to express pain the way that normal someone without dementia would be able to do.
That's right.
Sometimes it's a guessing game. You just have to figure it out.
Absolutely.
But a lot of times it is a medical. If they have a radical change, it's some sort of medical diagnosis. Yeah. So take them to the doctor.
Yeah, you've got to be a bit of a detective, right, to understand. And even when they say, like Laura referenced, a toothache, that's what they think they have. It may not even be a toothache. It may be another problem. Because another big one for our folks is constipation. Yeah. That's a real hard one for them to be able to express to their loved one what's going on. Yet they're experiencing pain. The pain is from everywhere with constipation. And it's something that needs to be addressed and focused on as well. Well, is to look at those three areas, right? Yeah. To say, okay.
Has there been a change in our environment at home? And sometimes there's your answer. Have I given him any over-the-counter medications that may have interacted with his regular medication? Or has his doctor changed his medications? Because sometimes they'll tweak the medications a little bit, and it'll cause a really crazy reaction. Sure. Just never know. And then if it's neither one of those two things, then it's probably some kind of medical issue.
Yeah. So you need to look for those. So again, don't race to the neurologist thinking he's gone to another stage and what are we going to do about it? Your job, and you know them better than anybody, is to rule out those things before we talk about, okay, maybe there's something else going on in the brain that we're not aware of. And that, of course, would mean neurological care for the individual.
If it were me and it were my loved one and I rolled out number 1 and number 2, I would make a doctor's appointment immediately to see what's going on, see if there's anything medical wrong. So that's what I would do. And with my brother, I had to trick him to go to the doctor because he didn't want to go to the doctor. That's right. Never wanted to go.
How'd you do that?
Well, I had to trick him several ways, but one way is I asked for his opinion. I told him I needed to go to the doctor and asked him if he would go with me because I need his opinion on it. And that's another thing that With dementia, nobody ever asks them their opinion anymore, and they really want to give their opinion. They really do. They're honored when you ask that. So he would go with me to support me. So that's one way. I tricked him several ways. I wouldn't tell him that we're going to the doctor. I would tell him maybe perhaps we're going somewhere that he'd like to go and would go there, the place that he'd like to go, but he's in my car. We can go straight to the doctor afterwards.
Sure.
So.
Yeah, I mean, our advice is really don't panic when you see it. And again, if it's happened overnight, but if we're seeing a pattern of it, we've addressed those other issues, then it's certainly beyond those three. And again, it could be more complex than we're able to diagnose as non-physicians, but as of people that have experienced all those things and the people that come here as well. Well, that's okay. But I mean, I would say the biggest one is that we had him in assisted living. They were providing as much care as they could for him. But again, he then became beyond the level of care that they could provide. So we had to make the move to a memory care. And that was a disaster. So there was no question about that. I didn't know how to handle it, and the community didn't do a very good job as well. So, we did the best we could to try to make him comfortable where he was at. And in that case, the change of environment, over time, he got used to it. Without proper training, he probably could have learned a little earlier than he would have with any other problem that he would have had.
I know, I remember one lady that was just normal one week, and over the weekend, she just started screaming at home. She was just screaming, and the family just could not handle it. I mean, can you imagine? Mm-hmm. So they just took her straight to a memory care and put her in a memory care because they just assumed this is it. And I can't handle this screaming. Well, put her in the memory care, and they fortunately have a doctor there and found that she had kidney stones. Mm-hmm. So I've had kidney stones, and I understand her screaming. Mm-hmm. So
certainly there are a lot of people besides Laura and I that talk about the things that we've mentioned today. I think educating yourself, and we're going to see there's a lot of books out there, the 36-hour day, and there's many of them out there today.
But a lot of times
great
people
resources.
Don't have time to read books.
That's right.
I mean, I love to read. That's one of my favorite pastimes. But when I was in the thick of it, I did not have 10 minutes.
Right.
So the podcasts are good, and there's a lot of really there's a lot. You can call the hotline with the Alzheimer's Association. They're great. Mm-hmm. So anyway, there's a lot of resources out there.
Have any others?
But the books are good. I'm not saying don't read the books, but sometimes you just don't have. You've got a problem. If you got a problem right now, you need to find out